Okay, in some patients we have a curved ST segment. Okay, now the next thing what we have to remember is that we treat the patients of Brugada syndrome, of course the patients who develop arrhythmias with quinidine, and we very often or we always avoid sodium channel blockers like procainamide, like ajmalin. So these agents are contraindicated in Brugada syndrome. We are going to talk about Brugada syndrome in much more detail, but let's first do the non-CV causes of ST segment elevation. We did the cardiovascular causes of ST segment elevation, which include ischemic and non-ischemic. And among ischemic, we had MI, we had Prince metal angina, which is a five-letter word for what? Transmural. What it was? Prince metal angina, coronary vasospasm. Okay, and in non-ischemic, we discussed five, I guess. Let's count. Number one was acute pericarditis. Number two was acute myocarditis, and number three was ventricular aneurysms, in which we have increased ST segment elevation even after the resolution of MI or even after revascularization procedure like PTCI has been done in the patients. And often during palpation we do feel a double apex, which is felt clinically on palpation or palpating the patient. Double apex, okay, remember this. Fourth one was early repolarization syndrome, which is totally physiological, and in that what we have is concave ST, and we drew that also. And in MI, contrarily, we have a convex ST elevation. And at last we discussed Brugada syndrome, in which we have a saddleback ST segment elevation, which appears like a horse saddle. And mostly in Brugada, the pathology is in right ventricle only, and it is because of late repolarization and normal depolarization. Now let's begin with non-cardiovascular causes of ST elevation. Let's talk about these non-cardiovascular causes, which are not related to cardiovascular system, and still the patient has ST elevation in the EKG or ECG. Okay, first one among these is hypothyroidism. Hypothyroidism. Second is hypothermia. Second is hypothermia. Now, in both of these situations, we have a very specific finding, that is of slurring of late portion of QRS complex. Okay, because of this slurring of the late portion of the QRS complex in ECG or EKG, whatever you call that, we have a very specific wave which is called Osborne wave. I'll just draw it in front of you. So what we have is slurring of the late portion of QRS. So the wave goes like this. And here we go. This is the Osborne wave. Remember this, very important. This is the Osborne wave. Okay. In both these situations, we find Osborne wave, but if the examiner asks specifically of if we have to think specifically, it is definitely more specific for hypothermia more than hypothyroidism. If you have to choose one, or you have to go with one option, then hypothermia makes much more sense for Osborne wave. Okay, now next, number three. Let's talk about number three. Number three is dyselectrolemia. Now, which electrolytes can give you ST elevation? Of course, that is non-CV cause or non-cardiovascular cause of ST elevation. There are two electrolytes which can give you, that is increased serum potassium or hypokalemia, sorry for that, and increase calcium or hypocalcemia. These two conditions can give you ST elevation. Okay, so you have to remember this. Also, it is very important to note here that not only ST elevation, we also, we talked about J point elevation earlier in some early videos. What is J point elevation? We talked a bit about that. Also, we can see J point elevation or ST elevation. Actually, both are the same, but J point is a more relevant term, or it is a more relevant point if we have to explain this elevation. So we can say ST segment elevation or J point elevation is seen with increased potassium and increased calcium, of course, serum values, of course. Then in some GIT conditions, also we have ST elevation. These include inflammatory or stimulatory conditions which are near heart. Okay, let's take an example, acute pancreatitis. Okay, and second example we can take is esophageal spasm. Esophageal spasm can also sometimes give you ST segment elevation. Last but not the least, okay, let me erase a bit of this. Last but not the least, we have drugs, some drugs which can cause ST segment elevation, and among these drugs we have antiarrhythmic agents or antiarrhythmic drugs which cause ST segment elevation. Okay, these drugs are class 1C, class 3C agents. These can cause ST segment elevation.